The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, ladies and gentlemen. Welcome to today's webinar titled The OPPS Final Rule. Please note that slides used in today's presentation will be made available to all attendees. A post-webinar email will be sent to all attendees with a convenient link to download the slides, as well as access video of today's presentation. At this time, it is my pleasure to introduce Jimmy Mendez, Senior Manager on BESLER's Reimbursement Services team. Jimmy, the floor is all yours.
Thank you, Tom. And thank you for joining us for this presentation today on the 2021 OPPS Final Rule, which came out a little later than it normally does. So this is our agenda for today. We'll be doing an overview of these categories, the OPPS and ASC payment updates, wage index, OPPS payment policy for 340B acquired drugs, procedures and surgical procedures added to the ASC covered procedures list, new service categories requiring prior authorization, overall hospital quality star rating, quality reporting as it pertains to outpatient, hospital outpatient and ASC. We'll discuss the elimination of the inpatient only list. We'll go over some new comprehensive APCs, and then we'll discuss COVID-19 reporting requirements, some new requirements. So first, regarding the OPPS payment rates, CMS is employing an increase factor of 2.4%, which is based on the final hospital inpatient market basket rate of the same for inpatient services paid under the IPPS. Now, CMS estimates the total payments to OPPS providers for calendar year 2021 will be approximately $84 billion, which is an increase of $7.5 billion from the previous year. Now, these figures take into account estimated changes in enrollment, utilization, and case mix for 2021. The increase due only to the changes to the OPPS in the final rule is an increase of $1.49 billion from the previous year. However, the statutory 2% reduction in payments for hospitals that fail to meet the hospital outpatient quality reporting requirements will continue. So what about the ASC payment update? Well, CMS adopted a policy to update the ASC payment system using the hospital market basket update, which will continue through calendar year 2023. As a result of these changes or these updates, CMS will update ASC payment rates for hospitals that meet applicable quality reporting requirements by 2.4%. This update is based on the projected hospital market basket increase of 2.4 with a 0.0 adjustment for multi-factor productivity. Now, this update will help to promote site neutrality between hospitals and ASCs and encourage the migration of services from the hospital setting to the lower cost ASC setting. And this will be a common theme as we move forward. Total payments to ASCs are projected to be around $5.4 billion, which is an increase of $120 million from last year. So regarding wage index, this will be based on the FY 2021 IPPS final rule, including the application of the OMB wage index delineations to determine the wage index, the wage adjustments for both the outpatient or the OPPS payment rate and the co-payment standardized amount for calendar year 2021. Now, all of this will start in a couple of weeks. CMS estimates an increase in payments of 0.2% for urban hospitals and 0.4% for rural hospitals. So what does the OPPS 2021 final rules state about 340B drugs? Well, we're going to go over that now. Now, most of you are aware that Section 340B of the Public Health Service Act allows participating hospitals and other providers to purchase certain covered outpatient drugs from manufacturers at discounted prices. And these are typically your very pricey, very expensive drugs. So this is very important for those hospitals that qualify. Now, CMS is going to continue the current 340B payment policy of paying average sales price minus 22.5% for the 340B acquired drugs. Now, keep in mind, when the proposed rules came out, the proposed rules indicated an ASP minus 28.7%. So between the proposed rules and the final rules, from a hospital perspective, there was an improvement of 6 percentage points. Now, the reason for this is that CMS believes that maintaining the current payment policy is appropriate in order to maintain consistent and reliable payment through this public health emergency that we're dealing with COVID-19. The 340B payment policy will continue to exempt rural sole community hospitals, children's hospitals, and PPS exempt cancer hospitals who will continue to be paid ASP plus 6%. Now, keep in mind, ASP plus 6% was what all hospitals at one point were being paid. So hospitals have attempted to challenge the payment reductions. However, those challenges were unsuccessful, as a ruling by the United States Court of Appeals for the DC Circuit earlier this year determined. So what about the procedures that have been added to the covered procedures list? Well, there are 11 of them, and CMS has finalized the addition of these 11. Under the ASC Final Rule, Medicare will pay providers for furnishing common services like total hip arthroplasty in ASCs. Now, you can find the full list of the 11 in Table 59 of the OPPS Final Rule, and it's on page 851. So what about surgical procedures that have been added to the cover list? Well, CMS is revising the criteria used to add surgical procedures to the ASC covered procedures list. As a result, CMS intends to add more services to the ASC covered procedures list. In this particular final rule, 267 surgical procedures will be added, and if this will start on January 1st, 2021. Now, again, the goal appears to be cost savings by allowing services to be performed in a lower cost setting, in an ASC setting versus an inpatient setting. Now, the 267 surgical procedures that have been added to the ASC covered procedures list can be found on Table 60, page 852 of the final rule. So there have been some additions to categories requiring prior authorization. There are two new service categories that have been added. This includes cervical fusion with disc removal and implanted spinal neurostimulators. These service categories will now require prior authorization. This applies for dates of service beginning in July 1st, 2021. Everything that we've discussed and will discuss commences on January 1st, 2021, but this one will begin on July 1st, 2021. So what about the overall hospital quality star rating? This is publicly reported on the CMS website. So currently there are 7 measure groups, and what CMS plans to do is to combine 3 of the existing process measure groups into one new timely and effective care group, and they plan to simplify the calculation of the average methodology for the group scores. So currently there are 7 measure groups, and with the combination of 3 into 1, we'll be down to 5 measure groups. So then there's the quality reporting. This is hospital outpatient quality reporting and the ASC quality reporting. So CMS will not be adding or removing any measure for either of these programs. However, they are finalizing changes to update and refine the requirements for reporting. The purpose is to further meaningful measurement while limiting burden. Now the CMS intends to eliminate entirely the inpatient only list. So what is the inpatient only list? Well, it is a list of a series of 1,700 procedures for which Medicare will only pay when performed in the hospital inpatient setting. However, CMS has raised concerns that the list has restricted patient choice when it comes to surgery and recently proposed to phase out the list. So the list will be phased out over a 3-year period. And the phasing out period will commence on January 1st, 2021, beginning with around 300 primarily musculoskeletal related services. There's actually 266 musculoskeletal related services and an additional 32 other services for approximately 300, a little less than 300. Procedures removed from the IPO list will be exempt from certain scrutiny from recovery audit contractors and from site of service claim denials for persistent noncompliance with the 2-midnight rule. There is also going to be some new comprehensive APCs. There will be 2 new ones to be precise. The CAPC 5378 pertains to level 8 urology. The CAPC 5465 relates to level 5 neural stimulators. So that brings the total CAPCs or comprehensive APCs to a total of 69. So finally, regarding COVID reporting requirements. CMS establishes new requirements in the conditions of participation for hospitals and critical access hospitals for tracking the incidence and impact of acute respiratory illness and providing this information and data to the Secretary of Health and Human Services. Again, this will be part of the conditions of participation. And in addition to the acute respiratory illnesses, there are new reporting requirements for inventory and usage of therapeutics to treat COVID-19. So you can find all this information in all 1,300 pages of the OPPS Final Rule at this location. So that concludes our presentation. Here are some more information on BESLER and some other services provided, but you can visit the BESLER, the www.besler.com site for more specific information. Thank you for joining us today.
Thank you, ladies and gentlemen. That concludes today's webinar presentation. Have a wonderful day.